Bob. It's all about diabetes and PAD management. Dr. Bob Gabbay is actually I should say, retired American Diabetes Association Chief Medical Officer. I don't know, would we consider you a retired endocrinologist as well? You're still very, very active.
Yeah, no, I'm actually still seeing patients at Joslin Diabetes Center and still at Harvard Medical School. So I'm keeping busy, just shifted roles.
We have lots of questions coming in. Make sure to like this video, subscribe to our channels, ask Dr. Bob. Also, the way to my heart helps us a lot, helps us to spread awareness for PAD as well as diabetes, and helps people get their questions answered in the right way with the right informant, such as Dr. Bob. So we have lots of questions coming in. Make sure if you do have questions, put them in comments and we'll get them to Dr. Bob, whether we get them to today or in the future, we will get to them for you. But we have Maria L, and she says her A1C looks okay, but her blood sugar still spikes after meals. What should she actually be paying attention to day?
Well, it's a good question. So A1C is an average of like where one's blood glucose, blood sugars are over 3 months. And it includes, you can have an average in different ways, right? You can have an average where all the numbers are pretty close to each other and the average is right in the middle. Or you can have an average where the numbers really vary a lot and you could have a lot of spikes, but also a lot of lows, and the average is good. So, what is really helpful are continuous glucose monitors that measure blood glucose continuously. And they give out a variety of reports, including this concept of the time in range, the percent of time where blood glucose is in the healthiest range. And that's probably the other number to look at along with the A1C to explain how many spikes there are and whether that is concerning or not.
Okay. James R, I've had type 2 diabetes for years. How do I know if what I'm feeling is just neuropathy or something more serious like a circulation problem?
Well, it can be tough to tell, and it's probably best to talk to your healthcare professional to sort of see. Um, you know, neuropathy, which is common feet, usually is like tingling or burning feeling. Um, a vascular problem is usually worse with activity. Like as you're walking, the pain is worse. Resting makes it better. That said, you can't 100% be sure. So always good to just, make a list of the things you want to talk about when you see your healthcare professional and bring it up.
Yeah, I think that's a good way to look at it, that if the discomfort increases when you're active, that is definitely a sign that you should get a vascular assessment. And I know tomorrow on Capitol Hill, that is something. I'm not sure if you're going to be there on Capitol Hill tomorrow, but they have the PAD caucus that is supposed to be getting together, and they're going to be talking about the ARC Act and early testing for people high at risk for circulation issues, such as diabetics. So that's going to be really important. So we'll have to stay up to date to see if we can get that going, because I think early testing is what's key with PAD and preventing vascular complications down the road.
Catching it early and preventing it from getting worse. That's the key. And
Okay.
honestly, that's the key for, pretty much all of the complications of diabetes. You could say the same thing about eyes or kidneys or, a whole bunch of different things. Catch it early.
It's and that's the thing, is that so many of these complications that we are experiencing that become epidemics today could easily be prevented with early diagnosis, serious management, diligent management, and support for these patients and accountability for them to maintain their A1C and keep it as much as you can below 6, which is critical. I know some allow a little loosey goosey, but from what I've heard from you and others, it's still better
Yeah,
if it's under 6.
it's a debate. I would say that strive for under 7. If you could do it safely, which means without low blood glucoses. If you can get it lower, it's probably better. But since most people are above 7, that's a good place to start.
Okay. Just lower is better, but what is right for you, it's between you and your doctor,
Yeah.
to make sure that you don't have those low moments as well. And I think it's a lot tougher for those who are insulin dependent, right? To maintain an A1C or a glucose that is below 7.
Yeah, I think the reason it's harder is because they're using medications, insulin, that can drop you too low. And you want to avoid blood glucose getting too low. And that's where really titrating it and, there are some continuous glucose monitor can help and alarming so you don't get too low, those kinds of things.
And so Angela wants to know, speaking of monitoring, do I really need to check my blood sugar at the same time every day, or can I check it just based on how I feel?
Well, it's a great question, and I have a lot of people that sort of say, "Well, I feel good, so why do I need to check?" Turns out that most people really can't tell unless their blood glucose is really low. You feel fine, and that's the tough part about thinking about diabetes is you can feel fine, the numbers can be high, it can be affecting your body and you wouldn't know it. So checking is helpful. Um, I wouldn't say that you need to check it always at the same time. In fact, it's helpful to check it at different times so that when you sit down with your healthcare professional, they can look at the trends at different times of the day. And the
Is it
most
different with type
useful
1?
numbers, yeah, I would say the most useful times in general are before meals and at bedtime. That's sort of a particularly good time. On insulin, very much so because they may be adjusting their insulin dose based on what their numbers are before meals and at bedtime.
Should we differentiate between type 1 and type 2 with that?
Yeah, I would say for people with type 2 that are not on insulin, um, they don't need number one need to check their blood glucose as often, and they're better off when they do check to vary the times they check. So, what one sees often is somebody checks every morning, which is great, but every morning just lets me know where you are in the morning. I have no idea how you are the rest of the day. Skip a morning and do it before lunch, or skip a morning and do it at bedtime. That gives a broader picture of how things are doing, and that is helpful for type 2 diabetes.
So Robert K says he walks every day. He tries really hard, but his legs cramp or feel a little bit heavy. Could that be related to my diabetes, even if my sugars are controlled?
I'm glad that question came up. So that really sounds like something we call claudication. And that's when you don't get enough blood flow to the legs. And typically, what the symptoms are pain that is in legs that is worse as you exert more, as you walk more, and it typically gets better when you rest. So this could be a sign of PAD, peripheral arterial disease, and it is worth talking to your healthcare professional about it. And although we talked about keeping your blood glucose in the healthy range, that makes the risk of developing these complications like PAD much lower, but unfortunately it doesn't eliminate it. So you can have good numbers but still get complications. So uh, the chances are much less, and it's definitely worth doing, but it doesn't rule out the possibility.
Okay, Denise M is asking about stress and how it affects blood sugar. She says, does it really affect blood sugar? I feel like mine goes up just from worrying about it.
Yeah, well, stress does. So stress releases certain hormones that can raise blood. And people that wear
Would
a
you mind?
continuous glucose,
I'm sorry, would you mind repeating that? We lost you for a second.
yeah, sorry about that. Stress definitely can affect blood glucose levels, and stress releases a hormone, cortisol, which can be part of the reason why blood glucose levels go up. People that wear continuous glucose monitors who get to see their numbers all the time, really, when they first came out, that's when people really started to notice, wow, I'm stressed, or shoot right up. Um, you know, Going to give a speech or, whatever stressful things there are. So absolutely stress can affect those levels.
If you keep your head a little bit steady, then it doesn't cut out as much, but it does cut out
Oh, am I
just
having
just a
uh,
little bit sometimes when you're moving around. And so
okay, let
that's
me just make sure
we don't
my
want to miss a
connections are
word that you say because
yeah,
it's
no,
so
no.
important. You're man a few
No,
words, but every word means so much and has such a tangible impact. Um,
no, I don't want that to break up. Hopefully this is better now.
yeah, much better. So Carlos P is asking, is it better to eat smaller meals more often or stick to 3 meals a day if you have diabetes? What's the rule of thumb?
Yeah, Carlos, it really varies from person to person, and what your goals are. For some people, eating smaller meals, it's easier to digest. If you're dependent on your own body's insulin, let's say you have type 2 diabetes and you're not on insulin, it gives your body a better chance to make enough insulin with each meal. Um, for people that are taking insulin, it may matter less, and it's really pairing the insulin and the dose with the amount of food that you're eating.
And Sharon W, my feet burn and go numb at night. Is that something I should just accept with diabetes as my primary care doctor says I need to, or should I get a second opinion and have it checked further?
Well, it certainly can be from peripheral neuropathy, a complication of diabetes. Uh, Over time, that the discomfort generally gets better. So what's happening when diabetes attacks the nerves, uh, they start malfunctioning, and they start just randomly firing. And that random firing can feel like burning, it can feel like tingling, it can feel like pain. Uh, Over time, the nerves die off, unfortunately. Um, the net result, though, is that there's no pain, but that's where you really have to be checking your feet because you may not notice little injuries to your feet. Uh, and then finally, there are medications that you take if that burn is really problematic, uh, that can help with neuropathy in terms of the symptoms.
We are cutting out again.
Oh, yeah, I'm
But
wondering
while
what's
you're
going
you're
on.
you're doing that, I can give you the next one because I find it interesting. I get this question a lot from folks. It's in regards to insulin resistance, and Mike D wants to see if you wouldn't mind explaining the difference between insulin resistance and needing insulin injections in plain English, is what he wants. Plain English.
Okay, I'm hoping you can hear me okay.
Yes. Hmm.
Um, so, you know, insulin is the hormone that helps to control the glucose, the sugar levels in the body. So let's start with that. Um, what can happen, particularly as people gain weight, obesity is one of the biggest reasons, that insulin doesn't work so well. And that, in essence, the body becomes resistant to the effects of insulin. The insulin doesn't work so well. Uh, you can overcome that resistance by taking insulin at a much higher dose and making up for the resistance. So that's the idea of insulin resistance. Insulin therapy, when people are injecting insulin, are a combination of reasons. One, um, people with type 1 diabetes, but also people with type 2, they don't many times make enough insulin. And so they have to replace the insulin their body cannot make. Um, and so that and people with type 2 diabetes can be resistant to insulin, as we just talked about, and their body may make some insulin, but not enough to overcome the resistance. And that's where taking extra insulin in the form of an injection can make the difference.
Yeah, and that's something that Kay was asking about. Kay says that she was on insulin injections for her type 2 diabetes. And then her endocrinologist said that she became insulin resistant. But throughout the whole time, she really struggled with losing weight. Suddenly, he switched her to Manjaro. And she said, why in the world did they not put me on Manjaro in the first place? Because it's been like a miracle for her. She's not only completely stable in her type 2 diabetes, but also she said that she's lost significant amount of weight and had to go shopping.
Wow, that's a good outcome. Well, Manjaro is a combination of two medicines, in essence, two hormones, GLP-1 and GIP, and it's quite effective. It helps people lose weight, and losing weight is a great way to improve insulin resistance. And it also stimulates the body's ability to make insulin. So many times, people taking that medicine may be able to get off insulin. Not always, because it depends on how much insulin their body can still make. But what happened with her certainly happens with many people. They lose weight, and their blood glucoses are better, and they get to go shopping.
It's really nice. She's so excited. I love those stories. GLP-1s, you mentioned GLP-1s, and that's just a combo drug, but the GLP-1s have had a real extraordinary past year or so, especially with the STRIDE trial showing that it makes a difference in walking ability for patients who typically would get claudication, right? Due
Yes.
to circulation issues, it reduces the inflammation and in the arteries, and but some are concerned still about the long-term side effects. How do you weigh the risks versus benefits if you are a patient, and is this something that May here wants to know, does she have to deal with it for life?
Well, yeah. So every medicine has some side effects, right? And as she asked, how do you sort of weigh the risk and the benefit? Well, it all depends on why you're taking it and what you need it for. Um, the good news about these medicines is the group of GLP-1s. There are older GLP-1s around for a while. They've been around for 20 years now. So we know a lot about it, and we know a lot about the side effects and long-term effects. So it it generally is quite safe. Um, they're very rare, very, very rare, like a handful of cases of some issues in terms of eye issues or pancreatitis. Now, you got to weigh that very rare, a few cases out of several, about out of multiple millions of people taking the drug versus that. And so the benefits, you mentioned, Kim, about the effects or the benefits for people with PAD being able to walk more, but people with heart disease, they live longer. They have fewer heart attacks. Um, People with heart failure do better, less likely to be admitted to the hospital with heart failure. People with liver disease, it improves them. People with sleep apnea, it improves their outcomes, and they sleep better. People with osteoarthritis have less pain. Um, People with diabetes and kidney disease do better on this class of medicines. So there's a whole bunch of benefits, and then there's some very rare side effects. So I think all in all, for the vast majority of people, the benefits way outweigh the risk.
And sorry, we have a few more questions just coming in. Becky wants to know, she said she's very frustrated because it seems like there are a lot of diabetes reversal programs that are available. But why is it that patients are not automatically referred by their primary care doctor to a diabetes reversal program that is appropriate for their particular insurance at the onset? Why is it that the patients have to go in and demand it for the most part?
It's a good question. I think different clinicians are aware of different things. So I think it's always good for people with diabetes to advocate for themselves. And something could have slipped somebody's mind, or, it's hard to know, make them aware. I think the programs can be very helpful.
Mhm.
Not everybody sort of is able to follow through on it. And so, but that said, certainly can be effective, and shouldn't be shy about mentioning it to your healthcare professional.
Yeah, I was just going to look and I forgot to look as to whether or not the American Diabetes Association has a list of resources of available diabetes reversal programs that, gosh, it would be great if it was broken down by state, but or even by insurance that people could submit their programs that are covered by each insurance into the American Diabetes Association, and they could have a finder for them.
Yeah, I'm not aware of that existing, but I could see how it would be really valuable. The other thing I'll just mention is the terminology uh, is more about remission than reversal, and the reason that matters is remission, which comes from the cancer world. It's a helpful way to think about it because it's not as if any of the programs will. Uh, you've got to remain vigilant. When you're in remission, people are monitored to make sure that they don't revert back, number one. Number two, they may still be at risk for complications. And so they should still get yearly eye exams and foot exams and those types of things. And that's why remission is a more helpful term than reversal.
And you had recently come on and talked about the American Diabetes Association and their new protocols. I'm curious, at that point, you said there was still a little bit more you wanted to read. Anything else come out of it that we hadn't talked about that maybe you're focusing on now or is of interest to you now?
We covered a lot of different things,
We
and
did.
each year, the this set of guidelines comes out and really does a very wonderful, comprehensive view of everything, all of the clinical studies that have been done. Um, One of the things I think that is exciting is automated insulin delivery devices. So
Mm.
these are insulin pumps that connect with continuous glucose monitors and deliver insulin automatically based on one's blood glucose levels are. Um, the recommendations now are really if someone is on multiple insulin doses a day by injection, they should really be considered for these devices because they're super helpful, and they make life easier for many people.
And I have one more key question for you. I've asked a number of doctors this question, and especially when it comes to diabetes, we haven't gotten a grade below an A minus for the new food pyramid. It seems to be very diabetes friendly. So, I mean, within reason, if you actually read it versus just look at the pyramid, there's a focus on general proteins and vegetables being at the top versus grains. And even fermented foods is on page two.
I think there's a lot of good things in the recommendations. I think there's concern about sort of red meat and saturated fat because of concerns about cardiovascular risk. Um, but it's certainly a step in the right direction. Calling out ultra processed foods is another important piece of it. And I think to your point, Kim, just looking at that pyramid doesn't give the full story.
Yeah, I think that's where a lot of people are mistaken. I think it was put together by a designer that was trying to figure out design
Yeah.
wise how things looked. And it was just unfortunate that that steak was right there, prominent and large in the
Yes.
corner.
Right. Yes.
From people I've heard behind the scenes, they said it really wasn't the intention of it to say, eat a big steak or eat a
Right.
big chicken.
Yes.
In fact, one Dr. Michael Danziger, who you met before, one of our
Yes.
diabetes reversal doctors, he said, "I actually wish people would eat less chicken than they do, because I don't think it's healthy to eat it all the time. I would rather people build up on more natural protein, more nuts and even some tempeh or things like that. Instead of just eating, we hear patients that,
Legumes. Yep.
yeah, just eat chicken every single night, at least once a day. And he said it's really not good. But if you're going to eat it, he says to make sure it's pasture raised and no antibiotics and this and that. But he said give the chickens a little bit of a break. Well, thank you, Dr. Gabby. We really appreciate you. Should I say thank you, Dr. Bob? Make sure you like the video, subscribe to our channel. We're going to try and do this regularly because we love Dr. Bob and we know so many of our patients. That's why, we wanted to have you back and we missed you. And we had several patients that were asking about you, including our friend Heinz, who's joined in the live studio audience. So please, let's do this on a regular basis. We'll gather a bunch of questions, still more to come. Thank you so much. Like the video, subscribe to our channel. Ask Dr. Bob, as well as The Way to My Heart. Thanks, everyone, for joining us, and have a great week.
Thanks.